researchers from the American Child Health Association gathered a sample of 1,000 children from the New York City public schools, and after finding that 65% of these children had already had their tonsils removed, the researchers took the remaining children and sent them to a group of school doctors and to have their tonsils examined. And 45% of these children were told needed to have their tonsils removed. So the researchers took the remaining kids that were told had their tonsils were okay to a second group of New York public schools physicians, and 44% of these physicians informed the parents that these children needed to have their tonsils removed. So the researchers one last time took the remaining children who at this point had been told by at least two groups of physicians that their tonsils were okay to a third group of physicians, and 46% of these children were told needed to have their tonsils removed. So the main conclusion of the study was that variation in the physician's assessment had less to do with the condition of the children as much as it did with the variation in the viewpoint and standard of the examiners. Now, this study was published in 1934. Fast forward to the mid-50s, during the height of the baby boom, and children of insured workers had a 50-50 chance of being told that they needed to have their tonsils removed, even though there was no evidence in the literature to justify that surgical intervention. It wasn't until the mid-1970s that physicians openly conceded that 50 to 80% of tonsillectomies were probably inappropriate. And a 1991 seminal study shared good news and bad news. And the good news was that only 1 in 4 tonsillectomies were inappropriate. And the bad news was that the tonsillectomy was still the most, it was the surgical procedure still most likely to be performed inappropriately.